Hi, my name is Mary Vukicevic and this presentation is about uveitis. The uvea is the intermediate vascular coat of the eye and it comprises the iris, the ciliary body and the choroid. And so when uveitis occurs, it's actually an inflammation of this uveal tract. So the structures that are affected are, as it says above there, the iris, the ciliary body, and the choroid. There are many variants of uveitis, and some of them can actually also involve the retina and the retinal vessels. So here's a list of all the uveitis types, and I'll go through what is affected under each category. So anterior uveitis is affecting the iris, or the iris and the ciliary body. So if it affects just the iris, it's called iritis, and if it affects the iris and the ciliary body together, it's iridocyclitis. So anterior uveitis is actually the most common uveitis that you will see clinically. Intermediate uveitis affects the vitreous. Posterior uveitis affects the fundus, and if you have retinitis, it's just the retina that's affected, or choroiditis affects just the choroid, or vasculitis affects the blood vessels. So basically it's just an inflammation of these areas. So if someone says a patient has iritis, it's an inflammation of the iris. If it's retinitis, it's an inflammation of the retina. And so these are subcategories of uveitis. Now, panuveitis is where the whole uveal tract is affected. And so you have involvement of the iris, the ciliary body, and also the sclera. The other type of uveitis that patients can get is endophthalmitis, which is an inflammation of all the intraocular tissues, but it does not affect the sclera. And this often happens it doesn't often happen, but it can happen as a side effect of surgical procedures. And then the last category is panophthalmitis, and this is where the entire globe is affected, so as opposed to endophthalmitis. So the panophthalmitis will also affect the sclera, and sometimes in addition to that it can extend to the entire orbit. As I said to you before, the most common uveitis is the anterior uveitis and iritis specifically, but you will come across some of these others too. Uveitis can have a sudden or a gradual onset, and it can last 3 months or less, and then in that case it's a limited disease, or it can last longer than 3 months, and in that case it's classified as a persistent disease. And it can be also defined as being either acute, recurrent, chronic, or in remission. So acute uveitis is where the patient has a sudden onset of the inflammation and it's of limited duration. If it's recurrent, they experience repeated episodes, and so it kind of flares up and then stops. So it's active and then inactive, and this can often last more than 3 months. And then chronic uveitis is a persistent inflammation with prompt relapses if treatment is stopped. And then if it's in remission, it's been inactive for at least 3 months after stopping treatment. When you're seeing a patient with suspected uveitis, it's very important that you take a careful history, and this is essential to help establish a reason for the uveitis occurring. And as part of the history, you should consider the patient's age, their race, their geographic location where they live and spend a lot of their time, or where they've potentially been holidaying, for example, any past ocular history, past medical history, their hygiene and dietary habits, any history of sexual practices, recreational drug use, and pets. And as I go on in this presentation, you'll see why all these are important. So let's take a closer look at these patient history taking areas and why they're so important. And we'll start with age. Certain types of uveitis are confined to certain age groups. So, for example, uveitis, which is associated with juvenile arthritis or toxocariasis, typically affect children. So that's why age is an important factor. Race is important because some races are predisposed to systemic conditions which involve uveitis, and some of these systemic conditions include a disease called Behçet syndrome, which is prevalent in certain races and quite common around Mediterranean, Middle Eastern areas, and also in people of Asian descent, particularly Japanese descent. Infectious uveitis can be endemic in some locations. For example, uveitis caused by Lyme disease, and therefore geographic location and where the patient spends a lot of time or has spent a lot of time could be important. Holiday destinations and so on are important. Past ocular history is important because uveitis can result following any previous ocular trauma or surgery, so it's useful to ask that. And then past medical history is important because the patient may have been exposed to infectious agents, things like tuberculosis or syphilis, and uveitis can be common with these systemic diseases. And also some treatments or some prescription drugs can cause uveitis too. In relation to hygiene and dietary habits, this is a good question to ask because you can have hygiene-related or dietary-related causes of infection. So, for example, toxocariasis is a causing factor for uveitis, and it's where patients have potentially been exposed to puppies or dogs, and dogs and puppies transmit toxocariasis. Toxoplasmosis is another organism that can be transmitted by cats to people, and so they develop uveitis secondary to that. But you can also acquire toxoplasmosis from undercooked meats or being exposed to or eating soil. Now you're probably thinking, well, I don't eat soil, and most of us don't. But sometimes if you've gone to a restaurant and they haven't washed the salad properly, or you haven't washed your vegetables at home properly, you could be exposed to toxoplasmosis and actually not know. And you ingest it, and you can develop uveitis as a result of that. There are underlying systemic conditions such as syphilis or HIV, which also cause and are related to uveitis. So if you're suspecting a patient has uveitis, then getting a history of their sexual practices is important. Recreational drug use, the same scenario, because the risk of HIV infection or fungal endophthalmitis from recreational drug use, sharing of needles and so on, can predispose a patient to having uveitis. And then pets, that's related to the hygiene and dietary habits question, because it's toxoplasmosis that can be transmitted by cats, and pet dogs can transmit toxocariasis. I'll talk to you about those two problems shortly. I'm going to run through the clinical features of anterior uveitis, posterior uveitis, and intermediate uveitis. Anterior uveitis can be either acute or chronic, and this slide is showing you acute anterior uveitis, and this is the most common form, and it accounts for 3/4 of cases of anterior uveitis. And what happens is the patient has unilateral eye pain, photophobia, redness and watery eyes, and it's of sudden onset, and it's been going on for less than 3 months. And it's acute anterior uveitis is easily recognised because the symptoms are quite severe, and it forces the patient to seek medical attention. So the 3 images on the slide show meiosis on the left due to sphincter spasm. So remember I said anterior uveitis can involve the ciliary body, and so the ciliary body is bunched up there, and the iris is bunched up, and the sphincter is closed up. You can also get ciliary injection or red eye and corneal endothelial dusting in the picture on the right hand side. So if you have a patient with acute anterior uveitis, in their file notes you might see a grading of how severe the uveitis is. You don't actually need to know this table, but you should be aware of it to understand what it means when you come across this in a patient file. Basically, it's a count of the number of aqueous cells shown or present in the anterior chamber. So if it's graded as more cells, that means there's a more severe disease process happening. So if there are, say, 26 to 50 cells in the field, this is a 3+ anterior uveitis grading, and that's a fairly severe disease. So what happens to these patients with acute anterior uveitis? Well, actually, the situation is quite good, particularly if they get treated quickly, and the uveitis usually resolves within 5 or 6 weeks, and the prognosis for good visual outcome is quite high. The problems arise when they don't seek treatment immediately, or the treatment doesn't properly manage the condition. The other thing that can occur is one of the treatments, and we don't discuss treatment in this subject, but one of the treatments is prescribing a steroid drop, and this can increase the intraocular pressure in the eye, but it doesn't usually lead to long-term damage, because these patients are not often on the steroid drops for too long a period. Chronic anterior uveitis, as opposed to acute anterior uveitis, is quite less common, and it's characterized by persistent inflammation that promptly relapses in less than 3 months after stopping treatment. The presentation is actually gradual, and a lot of patients are asymptomatic until they develop other complications secondary to it. So, for example, cataract or band keratopathy. And because of the lack of symptoms, patients at risk of developing chronic anterior uveitis should actually be routinely screened. The inflammation in these cases persists for quite a long time, more than 3 months, and sometimes even years. And these patients do go into remission or get flare-ups quite commonly. And the prognosis, really depends on the situation, and they can develop ongoing complications, for example, cataract and glaucoma as a result. Patients will have aqueous cells and aqueous flare-up. They'll have nodules on the iris, and they'll also develop keratic precipitates, and these are clusters of cellular deposits on the cornea, and you can see them here on the these little brown spots that are on the cornea. I'll just bring the arrow over there. These little brown spots on the cornea. The pupil is here, and the iris is there. Posterior uveitis includes retinitis, choroiditis, and retinal vasculitis, which I think I mentioned before, and often you get involvement of both the retina and the choroid. The symptoms will vary according to the location of the inflammation. So if a patient has retinal vasculitis, it usually affects the veins more so than the arteries, and you can get yellow or grey areas across the vessels. Retinitis will show active lesions and whitish retinal opacities with indistinct borders due to surrounding edema. So whenever you see anything that's a bit blurry on a picture of the fundus, it's usually related to edema or swelling. And then choroiditis is characterized by a round yellow nodule. It's a good idea for you to know which areas are affected by posterior uveitis, but if I was to show you a picture of, say, retinal vasculitis, I wouldn't expect that you would actually know what that is. And the last form of uveitis is the intermediate type. And this is a really insidious and chronically relapsing disease where the main site of the inflammation is actually the vitreous. It can be associated with systemic conditions or can just be idiopathic, occurring because of no known cause. And it's less severe if it actually starts in the patient before the age of 10. It accounts for about or up to 15% of all uveitis cases and about 20% of pediatric uveitis cases. When it started in the patient might be hard to determine because it can go on a long time before the patient seeks help. They do eventually experience blurred vision, but this is very slow to come on and they may not notice it. And floaters is another sign or symptom of uveitis. Usually the symptoms occur in one eye first, but eventually it becomes bilateral and it's often asymmetrical. So what they experience in one eye is quite different to the other. Uveitis is commonly associated with quite a few different systemic diseases, and you will see patients with these in your clinic. Ankylosing spondylitis is one of these, and it's where you get inflammation, calcification, and ossification of the ligaments and joint capsules. And the picture of the man on the left-hand side that's kind of hunched over a bit, he has ankylosing spondylitis. The other type of systemic disorder where you can have a uveitis associated is juvenile idiopathic arthritis. Now, this is different from juvenile rheumatoid arthritis, and it's an inflammatory arthritis of at least 6 weeks duration before the child turns 16. Crohn's disease is another systemic disorder that is associated with uveitis. Crohn's is a idiopathic chronic disease where you get relapsing inflammation of the intestinal wall. And a picture of that is shown in the center there. Sarcoidosis is an idiopathic granulomatous inflammation which affects the lymph nodes and the lungs and the liver, and uveitis is commonly associated with sarcoidosis. And then finally, Behçet's syndrome, which I spoke to you about before, shown on the right-hand side there, is an idiopathic multi-system disease. And what happens is the patient will develop episodes of where they get ulcers on the mouth or the genitals recurrently. It mostly affects people of Eastern Mediterranean and Japanese descent, and it affects males more than females. And finally, let's talk about toxoplasmosis and toxocariasis. So toxoplasmosis is caused by an intracellular protozoan, the Toxoplasma gondii, and cats are definitely the host of this protozoan. Humans become infected by ingesting soil containing the toxoplasmosis. So, for example, as I said before, poorly washed vegetables and so on, or through accidentally getting contaminated when cleaning out cat litter or consuming raw or undercooked meat that contains the toxoplasma. Or it can also be transmitted from the mother to the fetus during pregnancy. Toxocariasis is an infestation with intestinal roundworm of dogs, and it comes from the Toxocara canis, and the transmission occurs by accidentally ingesting soil or food contaminated with the Toxocara, which has been shed through dog feces. So what happens is the patient often presents between the ages of 2 or 9 years with leukocoria, which is the white reflex from the pupil, which you can see on the right-hand side there, strabismus, unilateral vision loss, and anterior uveitis and vitritis. It's not all that common, but you will see patients with this from time to time. This brings us to the end of the uveitis presentation. So just a reminder that the uveitis is an inflammation of the uveal tract, which comprises the iris, the ciliary body, and the choroid, but can also involve the retina and the retinal vessels from time to time.